have seen in today's video title, we are going to talk about muscle contractions. Masseurs focus on that. We work on the muscle contractions of the body. So if you want to give massages, this is a video you need to watch. I will quickly tell you that a muscle contraction is a shortening of the muscle fibers. And in today's video, I will show you the 3 basic ways to work on muscle contractions and be able to eliminate them. First of all, let's talk about what muscle contractions are. Usually when people come for their massage, they tell us they have 1 or 2 muscle contractions in their body. What I'm telling you is that you may have 1 or 2 muscle contractions that hurt, but you probably have many more contractions spread throughout the rest of your body. That's why a masseur, even if a person comes complaining of a specific pain, always has to assess the entire area to see if there are other parts of the body involved causing that muscle contraction to hurt. Thank God not all muscle contractions hurt us, because if they did, we wouldn't be able to move. But just because they don't hurt doesn't mean we don't have them. Thus, a skilled masseur must possess the ability to identify, using their hands, the locations of these muscle contractions and the techniques required to alleviate, relax, and elongate them. The regions of the body where we will consistently find more muscle contractions are the lumbar area, the neck, shoulders, even the jaw. And it is extremely common to experience muscle contractions in both the quadriceps and the muscles of the calf. There are also different types of muscle contractions. You will see that there are contractions that are smaller, easier to manipulate, but there will be other contractions that have been present for a long time, are already chronic, and will be more difficult to treat. So I'm going to demonstrate 3 extremely simple and efficient methods to address each of those various types of muscle contractions. And above all, the most important thing is that we are going to learn how to use our body, our posture, and our weight to not overload ourselves and not harm ourselves while helping others. Something that often happens is that people dive into giving the massage without taking care of their body as a masseur. That's why we are going to use our body weight properly, maintain a correct posture, and take care of that. To do the job as best as possible without harming ourselves, we are going to use 3 different techniques. To address muscle contractions, we'll warm up the area using knuckles or kneading with a pinch as the first step in our approach to working on the muscles. We are going to use kneading all over the body in very extensive areas. We begin with kneading movements to familiarize ourselves with our client's body. Moreover, we will stimulate blood flow, which helps us effectively address muscle contractions. So the first thing we're going to do is these kneadings in all the areas we want to work on and where we already know that many muscle contractions accumulate. And how is this kneading done? Well, depending on the area we are going to work on, we will be able to do it in a certain way. We will consistently position ourselves in front of the area we are going to work on. We will adopt a relaxed posture with slightly bent knees, with one leg positioned forward over the other to shift the weight of the body and maintain stability during the task at hand. To avoid injury, it's important to do this. To work on the shoulder and neck area, we'll position ourselves behind the person. The person will be lying face down, and we can work on either one shoulder first and then the other, or both at the same time. Here we are going to execute superficial, medium, and deep kneading maneuvers in our massage technique. To perform the pinch, place your thumb underneath in the area of the collarbones and leave your fingers in the area of the upper trapezius on the back. You do not have to utilize force with your hands. We are going to lean over the body and simply utilize our hand to mobilize that mass to check its hardness. And we are going to do this for as long as we need until either the area becomes red or softens. When I do this kneading, how do I know where the muscle contraction is? I will notice that the contracted area is much harder, and I will feel a difference when passing over it compared to the rest of the tissue. I may encounter different types of hardness that can be small and circular or elongated. I'm going to palpate that with my fingers, palm, or even with my knuckle. If you still don't easily identify the muscle contraction by doing this, I recommend closing your eyes, as this way you will sharpen your sense of touch and have a much greater perception of it. It is important that in these maneuvers you feel as if you were kneading a loaf of bread. In the end, the texture should be homogeneous, and that should be your goal. For the lumbar area, we will position ourselves on our side, on the side we are going to work on. And we will always knead the entire area we find, from the hip, the iliac crest, to the ribs, and in the legs we can work both face up and face down. Facing down, we'll focus on the back of the thigh, the whole area of the hamstring muscle. To make it easier, we can slightly bend the knee so the muscles are more relaxed, allowing for more effective massage. And we will be able to work on the calf and quadriceps area perfectly without any problem. The second technique I am going to demonstrate is stretching the fascia using the side of the arm. Using this maneuver, we will execute lengthy movements that span the entire area, stretching from one end to the other. We are going to position ourselves in a way that we can lean on the person and have a slight 45-degree angle in the arm. This technique is worked on with 3 levels of depth. The first one will be very superficial to mobilize the skin over the muscle with minimal effort. We will move the arm across the entire area we are going to work on. Next, we'll work on the middle level. We'll start to shift a bit of the body weight, and we'll get into the muscle without forcing it, but applying a bit more pressure along the same path from one end to the other of the area. Lastly, we'll do a deep tissue massage in the same posture and following the same path. Our aim is to apply slightly more pressure using our body weight while ensuring the recipient can still handle it. This will allow us to work on the deeper layers of muscle tissue and the contractions that are more tightly attached as well. It is very important to keep in mind that these maneuvers should not be painful, and you should always adjust to each person's tolerance. We have the ability to execute it with utmost precision in the trapezius area, positioning ourselves on the person's back along the vertebral column and lumbar region. We can also do it on the gluteal area and of course on the legs. With these maneuvers, you will have already done a fairly complete job on the muscle contractions, but it is very likely that there are still some located in very specific areas. That's why we are now going to use the thumb or elbow maneuver, pinpointing exactly where those painful points are. If you have never done it, I recommend that you do it first with your thumb, since it has greater sensitivity and you will notice it much easier. This way you will be able to perfectly locate where that little knot is, and surely the person receiving it can help you with the feeling of pain. Once you have located it, you are going to place your thumb directly on it, and we are going to go to the limit as far as that person tells us it bothers them, but they can bear it. You will stay there while the person focuses on breathing, and you will be able to see how that muscle contraction slowly starts to release. That muscle that was contracted and painful in the beginning, little by little you will see that it loses its hardness and starts to stretch out. It will depend on how chronic the muscle contraction is. If the contraction is recent, you will loosen it very easily. But if you have been dealing with this contraction for several years, you will need to be patient and work on it over several different sessions. In the event that the area or your thumb becomes tired, or you feel that you do not have enough strength, that is the moment when we can make use of the elbow joint. Be cautious with the elbow, as it applies significant pressure and often goes unnoticed. Use your hand to position the elbow correctly during muscle contraction, and gradually apply some of your weight with great care. Keep in mind that the individual below you needs to indicate the precise point at which they can tolerate it. In this way, your posture will be easier, you will hurt yourselves less, and you will injure yourselves much less, also needing to exert much less force. With this technique, we can work on the same areas we have worked on before, both the trapezius muscle contractions and the paravertebral or lumbar muscle contractions, and we can also work on the calf, hamstring, or quadriceps muscle contractions. Furthermore, in addition to this, you can complement it with stretches for the affected areas. We have additional videos on stretches and other techniques that you can combine on our channel. You will see that little by little, as you practice, you will be able to locate them much more easily and work on them much faster and more effectively. I hope you enjoyed it, and if you did, you can support the channel by liking, leaving a comment, or subscribing. Moreover, if you become a member or subscribe to our Patreon, you will be able to access exclusive content. To learn more techniques, take our online course on Introduction to Massage that you will absolutely love. And that is the conclusion for today's video. I hope you enjoyed it. Always remember that your body is your temple. Farewell for now.